Breakfast with Ben Thompson and Victoria Valentine.
Good morning to you. Nurses in many parts of the UK have voted in favour of a strike over pay. Walkouts at hospitals and community teams are expected to take place before the end of the year, but emergency care won't be affected.
Well, nurses in every service in Scotland and Northern Ireland voted for strike action.
In Wales, there could be walkouts at all health boards except for one in the south east.
But in England, things are a little bit different. A low ballot turnout meant it's a bit more of a mixed picture. Nurses are set to walk out at just over half of England's health trusts. Well, we're joined now by Patricia Marquis, who's the Director for England at the Royal College of Nursing. Thank you very much for joining us on the programme, Patricia. Why is it, do you think, that so many nurses across the country feel that they have no choice but to strike?
I think what they're saying to the government is enough is enough. It's years of underfunding into the NHS and years of underfunding into nursing, so that things have just got worse and worse with higher pressure, and the value of their salaries has just fallen behind over the last 10 years. So I think really this is a signal now to the government to say we can't carry on doing this anymore. We need some radical action to improve things, not just for nurses, but primarily actually for patients.
Patricia, do you think that the government has underestimated the strength of feeling here?
I think they have. They've failed to listen. Successive governments over the last few years have failed to listen to what nursing staff are telling them, that things are not safe, that there aren't enough nurses, and the sorts of actions they need to take to improve things, both for nurses and for patients. And they just haven't listened. They've continued to do what they believe is the right thing, I guess, but the impact of that has been a deterioration in the services and more nurses deciding to leave the profession.
Now, of course, at this stage, it's very difficult to know exactly what impact there will be in terms of waiting times, for example, and in terms of services with regards to the strike. But we do know that there will be some, of course. Do you really believe that the ends justify the means?
So I think we have to put it in context, that services now are not safe, that people are waiting far too long for their surgery, for their outpatient appointments, for their ambulances, that when they get into the hospital or into the community services, there aren't enough nurses to deliver the care they need. We know that in our last survey, 83% of our members told us that there weren't enough staff on the last shift they worked. So things are already very, very difficult. So the disruption that we will cause will, of course, be disruptive. We will make it safe for patients, absolutely, but we can't say there won't be disruption, but it will not be on the level that is already happening every single day across our services.
What assurances can you personally give that services such as intensive care or cancer care, for example, are not going to be impacted?
So the way we will work with employers is to look at the services that need to remain active to keep patients safe. We would not want to see any patients suffer as a result of the action. So things like intensive care, things like emergency departments, we will be working with employers to ensure that they can continue to run on safe staffing levels, the same as we would, in fact, for any inpatient services or for people working in the community. There are some services that have to continue to ensure that patients are safe, and we will agree with employers what those are and what staff should be working to enable that to happen.
You know what, I'm just looking at some of the figures here. There are more than 7 million people in England alone currently waiting for hospital treatment. There are people who've been waiting for hips, for knees, people who desperately need district nurses, and those are services that will be affected by this strike action. The people who often rely on these services, they're older people. They've already waited the whole of the pandemic in some instances to be seen. Is it really fair that the burden is going to be felt by older patients across the country?
Well, I think I would turn that question around. Is it really fair that they're waiting as long as they are now? And of course it's not. And the reason they're waiting as long as they are now is because the government is continuing to do what it's done, which is to not pay nursing staff enough, which leads to more and more nurses leaving the profession, and a failure of an increase in nurses coming into the profession. So we're dependent on, overseas recruitment, and that's what's causing the problem. And that's why nurses are saying to the government, please, can you listen to us? You need to do something different. This is not working. Things are getting worse. We are seeing more and more nurses leave the profession, and patient services are suffering as a result.
Yeah, I saw, I think there's 50,000 or so vacancies in nursing across the UK at the moment. Are you able to tell us at this stage when these strikes might actually happen?
I can't tell you the precise details. We have to give employers across most of the UK 14 days notice of those of any action. In Northern Ireland, it's slightly different, but we will give the appropriate notice. What I can say is that we intend to take action certainly before the end of this year.
OK, thank you. Patricia Marcus, Director for England at the Royal College of Nursing.
It's worth saying as well, as you heard there, those strikes will not affect everywhere in the country, regardless of where you are, whether it's Scotland, England, Wales or Northern Ireland. So there are full details on the website to check what the services could look like where you are. Just check out bbc.co.uk/news. And as you can see, a load of details there down the bottom about what the services will be, what will be affected wherever in the country you are.